Good morning and welcome to CNS News. My name is Rodney Clemens.
And my name is Caleb Boyd, and this is where nothing is in the mugs. Over the past week, we have received multiple reports of people opening packages and ending up in the emergency room with some serious complications. But more on that later. We're going to start off this morning talking about a little micro madness circulating around in our community.
Yes, you heard that correctly. According to the CDC, over the last few months, Crapstone, Alabama has experienced the highest number of incidences related to Q fever and whooping cough seen in decades. Researchers speculate that this due to the fact that patients have been negligent when it comes to vaccinating their children as recommended by their physicians.
While these are some unfortunate events taking place in our community, we need to work together to prevent this infection from spreading any further.
Let's first talk about Q fever, which is a highly infectious disease that can cause serious illness. It is known that Coxiella burnetii is the culprit of this infection and is found worldwide. I know that most Alabamians in Crapstone are farmers, but we must be careful when coming in contact with our livestock. We know that this bacteria enters the body via inhalation or ingestion, usually caused by breathing in spores located in dust or hay that may be contaminated by animals. Q fever is easily spread from infected animals to humans with as few as 1 to 2 bacteria. Starting the infection, however, human-to-human transmission is rare.
The main risk factors relating to this infection are people with contact in livestock and others with compromised immune systems. Symptoms include muscle aches, cough, headache, and even shortness of breath. Q fever is known to have secondary infections which can cause symptoms to worsen.
If you thought that last infection was bad, then you better get ready for what is known as whooping cough, also known as pertussis. While Q fever has mostly affected farmers in Crapstone, whooping cough has made a much larger impact in our town due to the way this infection is spread. This infection gets its name from a more advanced stage where rapid coughs are followed by a whooping sound.
Interesting, Rodney. The bacteria Coxiella burnetii can be transferred from human to human via droplet transmission and is highly contagious. This means that being around someone who is infected when they sneeze, cough, or even close proximity can transmit the infection directly to you.
It was nothing I've ever heard before. He was coughing and doing the whoop. He'd vomit.
And he couldn't catch his breath. When they took Pedro to the doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection.
But Chelsea knew there was something else wrong. So the next time Pedro had a coughing fit, her husband got it on video.
A nurse practitioner saw it and diagnosed it right away.
And she saw it, she goes, that's pertussis.
Whooping cough is also known as pertussis. It's caused by a bacterial infection that is spread from one person with whooping cough to another person.
What is he doing?
Dr. Thomas Boyce says whooping cough is particularly tough on kids younger than Pedro, who haven't had the full course of vaccinations given at 2, 4, and 6 months.
They're particularly susceptible to getting infection, and because of their small airway, they're particularly susceptible to having very severe disease.
Caleb, what happens when this microbe infects someone?
Well, Rodney, this bacteria latches to the lining of the upper respiratory tract and then releases toxins that can cause the airways to swell. The risk factors associated with this infection are people with compromised immune systems, asthma, and even obesity. Symptoms may seem cold-like, for example, fever and cough, and usually occur for about 1 to 2 weeks.
Now, with that information in mind, if you or any of your loved ones experience any of these symptoms, do not wait. Please seek medical help.
While Q fever and whooping cough sound like some scary infections, they both can be treated at the hospital with a round of antibiotics. However, it is best to try to prevent these infections from occurring in the first place.
The best prevention for Q fever is avoiding contact with animals, especially ones giving birth, and if you work in a setting that involves animals, that there are vaccinations available.
Vaccinations have also proven to be the most effective defense against whooping cough and should be administered to an infant very early in life.
Pedro and his entire family took antibiotics to treat the infection and prevent further spread. Now he's back to health after months of illness.
Dr. Boyce says babies usually get whooping cough from adults who have a mild infection. He says that's why it's important for adults to get booster vaccinations every 10 years. Ask your doctor for the tetanus diphtheria shot that also includes a pertussis booster. For Medical Edge, I'm Vivian Williams.
It is time for the breaking news you've all been waiting for. As stated earlier, we have had multiple reports in the past few weeks related to individuals opening packages and becoming hospitalized by something known as anthrax. Let's go to Barrett Teeples with more on this story.
Thanks, Rodney. So the police are currently looking for a man who's been putting aerosolized Bacillus anthracis inside of boxes and leaving them in front of unsuspecting people's homes. We're not sure what the motive behind these acts of bioterrorism are, however, we must take action to prevent any further exposure. So here's what you need to know. This bacteria is most commonly known as anthrax, a deadly infection that can cause shock, difficulty breathing, and in serious cases it can lead to inflammation around the brain and spinal cord, causing severe bleeding and even death. The bacteria is normally found in agricultural regions where animals are located, and a vaccine is given to combat anthrax for people working around with the bacteria. However, in this case, it has been weaponized so the symptoms could be more severe.
Anthrax could be released in a city, quietly, without anyone knowing. It's microscopic, and you may not be able to see, taste, or smell it. Just a small amount of anthrax can make a lot of people sick.
Let's take a look at what happens when one of these boxes are open. First, the bacteria aerosolize, which means Bacillus anthracis spores will float around in the air and are usually inhaled. After entering the body, the bacteria will replicate and produce toxins causing severe illness. Treatment when exposed to this bacteria can include antibiotics such as penicillin and doxycycline. In the event that you have opened one of these packages, call 911 and seek medical attention immediately. Thank you. Back to Rodney and Caleb.
Thank you, Barrett. That was very informative. I will say, I don't know if I would want to open random packages on my front porch to start with.
Well, personally, I think my curiosity would get the best of me if I was opening a package on my doorstep.
Well, I guess the moral of the story is don't open up random packages on your front porch because the surprise might be more than you bargained for.
Well, thanks, Caleb. We will now move on to our weather segment with our meteorologists, David and Sardo.
It's really weird.
I don't think I'll need them because the prompt will be up here. Just throw it on the floor.
Can you see it?
Huh?
Can you read?
Yeah.
Donnie, you just scratch out your name and run into it. You might subconsciously do it, but just...
Over the past week, we have had multiple reports of people opening packages and ending up in the emergency room.
Looking for a man who's been putting aerosolized Bacillus anthracis inside of boxes and leaving them in front of unsuspecting people's homes, such as this package right here. I was trying not to laugh.
All right, so you gotta stay serious because you're already like looking funny as hell.
He's making me, he's staring right at me and laughing.
Just block him out, man.
Because I'm not gonna lie. Hilarious. But the fact that you keep it serious is gonna make it even more.
Okay. All right. Aerosolized Bacillus. So that's a tongue twister. By the end of it, like my hands are just. I'm not sure what to do with my hands. Yeah.
I mean, no, you just be like. You work in a setting that involves animals, that there are vaccinations available for those animals. Let's go to Barrett Teeples with more on this story.
Thank you, Barrett. That was very informative.
Well, personally, I think, out of curiosity, I would get the best of me if I package on my doorstep. Wait, what?
Yeah, there you go. Typical cowboy stance.